Hello, I'm Dr. Gerald Bush with Allison Chang, and we'd like to welcome you to a joint presentation of the American Academy of Addiction Psychiatry and American Academy of Child and Adolescent Psychiatry. It's our pleasure and privilege to welcome you here today to Betting on the Future, Gambling Disorders in Youth. What I'll do in a moment is proceed to the disclosures. But before doing that, I'd like to just give you a brief outline or framework for your own information of what we'll be reviewing today. We'll have our disclosures and then go over our learning objectives. Uh, Dr. Chang will provide a clinical vignette, and then we'll have a slide on why this situation has become so formidable. What are the changes in the legal and virtual landscapes that have allowed this? We'll review the DSM-5 TR criteria for gambling disorder, uh, as well as how to rank severity. We'll review the risk factors and what needs to be completed in a clinical assessment, uh, and probably most importantly, screening, which is your epidemiologic fishing expedition for your clinic. And finally, we'll cover treatment, and then we'll be happy to take your questions. Before proceeding to, we'll go ahead and go to disclosures. I'm Gerald Bush. I'm with the Child and Family Mental Health Services at Tripler Army Medical Center, Uniformed Services University for Health Sciences, and also on the faculty in the psychiatry department at the University of Hawaii. Dr. Cheng is at Stanford University. We have no relevant financial relationships with ineligible companies or other companies to disclose. And because I work at an Army Medical Center, I also need to say that uh, these views expressed do not reflect the official policy of Stanford or Triple Army Medical Center or the Department of the Army, Department of Defense, or the U.S. government. I'd like to frame our discussion today before we proceed with a quote from Euphrey Kamener, and this is from Kamener and Winter's Clinical Manual of Youth Addictive Disorders. Adolescence is characterized by a neuropsychological process in which dopamine-related overvaluation of reward in the limbic system, underestimation of risk, and immature regulatory inhibitory functions in the prefrontal cortex can explain the high level of sensation-seeking behavior, including, in this case, gambling disorder. The quote was designed for substance use disorders, but I've adapted it because it so succinctly summarizes the features of adolescence that contribute to the vulnerability to this disorder. And so at this point, I'll turn the floor to Dr. Chang. Thank you.
Hi, everyone. My name's Allison. I'm one of the CAP 1 fellows at Stanford University, and I'll be co-presenting with Dr. Bush on this webinar regarding pediatric internet gambling disorder. So here are the virtual forum logistics, and here are our learning objectives. So discuss developmental and digital risk factors for gambling disorders in youth. Apply validated screening tools for adolescent gambling disorder in clinical practice, and identify evidence-based psychosocial treatments for pediatric gambling disorder. So I wanted us to start off with a clinical vignette. So we have M, a 14-year-old male with no significant medical history and a psychiatric history of ADHD. And he was brought into clinic by his family due to concerns about M's screen time use and spending habits. And so M opened up a Roblox account around 3 months ago because all of his friends had been gaming online. And over the past few months, M started to progressively spend more time on Roblox and other gaming websites. The patient no longer wanted to spend time outdoors and play with his younger brother, but instead was staying in his room on his phone and on the laptop playing games. He would start playing Roblox well into the night, sneaking his phone and his laptop into the bedroom despite the family's no phone policy. And so in the morning, he was fatigued and his grades started to decline. His father also noticed that M was spending more money on Roblox and other video games. And so initially, M had been spending around $10 to $15 a week on loot boxes and skins. However, his father was notified by the credit card company that M had spent over $500 in a week with these in game transactions. And so when his father confronted him, M said it was a mistake and promised never to do it again. However, his father later found out that M spent a similar amount of money the following week. And when M's father attempted to limit his spending, M became upset and started yelling and hitting his father. And so, when asked about his spending habits, M noted, I'm worried about missing out, so I keep buying them. I don't know what's in them, so I keep thinking, what if it's the one I really want? And so, with that clinical vignette, it highlights this rise of microtransactions. And so, microtransactions are in game purchases where the player is using real currency to purchase specific advantages or items within the video game. And so, one primary example you can see on the top left is an example of a skin. And so, for skins, they're items that can modify the appearance of the in game character. So, almost like a different costume. And so, as you can see, for this particular skin, we have different shirts, shorts, tiaras, and different types of winks. And then if you go down to the bottom right, you can see an example of a loot box. And so loot boxes go by many different names like crates, gotchas, and chests. And these are random purchases where the player doesn't know what they're purchasing. So essentially, they don't know what's in the box. But what they're hoping for is an advantage or these highly desirable items that can be utilized in the video game. However, more often than not, these highly desirable objects have low chances of being in these loot boxes. And so there's significant concerns that these loot boxes are a form of gambling for minors. And then, as you can see on the top right, buy Robux, the left-hand column shows how much money an individual needs to spend to buy a certain amount of Robuxes. So Robux is the in-game currency for Roblox. And what's interesting is that it's not necessarily a one-to-one conversion rate. And so this can be confusing for both kids and parents to fully understand how much a child is truly spending in the video game. And so, with the clinical vignette and with these microtransactions, it really highlights this convergence of both gambling and gaming. And so, gambling has reemerged as this major public health concern in the United States. And there's several major factors that is driving this. So, one of which is the US legal policies have significantly shifted in the past several decades, which have now allowed for greater flexibility in internet gambling. So, the Professional Amateur Sports Protection Act, so PASPA, of 1992 federally prohibited majority of states from legalizing gambling. And this was overturned by the Supreme Court in 2018. And so, with the overturn, it allowed each state to determine the legality and the regulations of gambling, which included both retail as well as online gambling and sports betting. And so, as of February 2025, 46 states have legalized some form of gambling. This excludes state run lotteries. And so, if we were to include state run lotteries, the number would be 48 states. And then the other concern also includes the rise of smartphones. And so, with smartphones, children have easy and constant accessibility to online gaming and gambling. And so, this allows kids to have accessibility to esports betting and virtual currency based casino games. And when we look at the interface of gambling apps, it entices users with free incentives. And so, one primary example of this would be like multi bets or parlays. So, the player will place multiple wagers on different outcomes, and the payout is dependent that each bet is that's placed needs to be a success. And so, this can be highly rewarding, but then highly addicting as well. Then there's also the so-called risk-free bets. And so this is usually when we have a first-time player, they lose a bet, and then they're refunded their losses in the form of site credits that can then be utilized for future gambling endeavors. And all of this is happening in the online sphere. So this provides a level of anonymity for all the users. And so this can contribute to dangerous gambling behaviors. And then, in addition, another major contributor also includes social media. And so, for kids, they can be exposed to gambling content through influencers and streamers. And so, one primary example is Twitch. So, Twitch is a popular live streaming platform, and it primarily provides gaming related content. And it's estimated that for Twitch, a total number of gamers or audience who can be live streaming Twitch can be more than even 800 million gamers worldwide. And so a significant number are under the age of 20. And so, in addition to gaming, many of these viewers on Twitch can also watch their favorite influencers stream gambling activities. And so, while Twitch has attempted to regulate gambling content on its platform, including age restrictions and bans on certain sites and domains, it's not really clear as to whether or not these regulations have had any impact. And so, when we think about our pediatric population, teens are at particularly elevated risk for developing a gambling disorder due to developmental vulnerabilities. So, this can include impulsivity, heightened reward sensitivity, increased salience of peer influence, and the ongoing development of frontal lobe maturation. When we look at lifetime gambling participation among adolescents, it's estimated to be between 42 to 90%, with problematic gambling prevalence estimated to be between 0.2 to 12.3%. And these rates are roughly 2 to 4 times higher than those in adults. Well, also, when we look at teens, it's estimated that about 5 to 15% have engaged in online gambling. And so these online modalities include sports betting, social casino gaming, and loot boxes. And in general, when we do look at adolescent gambling, it is certainly not benign. It is associated with increased risk of anxiety, depression, substance use, delinquency, and even suicidality. I also wanted us to take a moment to review the DSM-5 criteria for gambling disorder. And in general, for gambling disorder, it belongs under this broader category of substance related and addictive disorders. And gambling disorder is classified as a behavioral addiction. So it reflects its shared neurobiologic and clinical features with substance use disorders. And so, for an individual to be diagnosed with a gambling disorder, they have to have persistent and recurrent problematic gambling behavior leading to significant impairment or distress. And they have to be exhibiting at least four or more of the following symptoms in a 12-month period. So, this includes frequent thoughts about gambling, needing to gamble with increasing amounts of gambling activity to achieve that same level of excitement, repeated efforts and being unsuccessful to try to control, cut back, or even stop gambling, feelings of restlessness and irritability when trying to cut down or stop gambling, utilizing gambling to try to escape from problems or negative mood, and then, if losing an item of value due to gambling, having this need to continue to gamble to get even. And so, this is also known as chasing the loss. And then, gambling when feeling distressed, lying to the extent of how much this individual is gambling, losing important opportunities like jobs, school achievements, and even close relationships. And then also relying on others to help with money problems caused by the gambling. The gambling behaviors cannot be exhibited during a manic episode. And then the severity of the gambling is based off of the number of symptoms the individual is exhibiting. And so, for risk factors, unfortunately, certain adolescents are consistently overrepresented in clinical and in epidemiological samples. And so, for example, individuals with substance use disorders, impulse control problems, and mood and anxiety disorders all exhibit increased risk for the development of gambling problems. And then for gambling, it's very comorbid with ADHD, depression, bipolar, trauma related exposures, and other externalizing behaviors. And when we look at these comorbidities, they're often reinforcing one another due to shared pathways of impulsivity, reward dysregulation, and maladaptive coping. And unfortunately, certain socioeconomic vulnerabilities can also further amplify this risk. And so, kids and families who are experiencing financial instability may potentially view gambling as a route to rapid financial relief. And so, this can increase participation, but also increase the persistence of gambling to make up for the gambling losses. And when we look at gender, historically, gambling disorders have been viewed as more common among young men. However, there is a growing number of young women presenting with gambling problems, especially when we look at the online contexts. Then, for racial and ethnic inequities are also highly evident. And so, research has demonstrated higher rates of problem gambling among racial and ethnic minority youths compared with white youths. And so, in one college study, it showed that for Asian American young adults, they gambled less frequently than their peers, but spent significantly more money, and a larger proportion met criteria for probable pathological gambling as well as at high risk gambling. And so when we look at this pattern, it suggests that for some groups, they may be engaging in less frequent gambling, but higher intensity or higher stakes gambling. And so that this can come potentially with greater financial and psychosocial harms. Also, cultural norms related to gambling, stigma around help seeking, and differential exposures to marketing can all contribute to these differences. And so, with that, I'll turn it over to Dr. Bush.
We'll now proceed to the features of clinical assessment in your intake and history. Your assessment should include an assessment for substance use disorders, and your clinic should also do screening for substance use disorders, such as the CRAFT or S2BI, and a mental health history should be collected as well. Clinicians should explicitly inquire about digital habits, screen time, and include gaming, social media, and online spending. Many, if not most, or all youth involved in these activities do not label their behavior as gambling. So you not only want to avoid the term gambling, but you should use concrete examples. So you would ask about sports betting, fantasy sports with money or prizes, online casino games, poker or slots, loot boxes and card packs, and casino games. So asking something like, have they placed a wager or a bet or used money to buy something that they weren't sure if they were going to get or not in terms of chance, a game of chance. You also want to discern whether the activity they're doing is purely recreational, whether it's part of some activity that other friends are doing, or to what degree they're using it to cope with distressing feelings or unpleasant affect. You would want to go through the criteria for gambling disorder and, for example, ask if they ever spent more money than they intended to spend, used money meant for other purposes, borrowed money to gamble, or concealed expenditures. Unlike uh, substance use disorders, one of the criteria for gambling disorder is deception or hiding behavior. And it's interesting because that happens to be a feature of substance use disorder, but not a criterion of substance use disorders, but it is explicitly here. And the fact that these activities are virtual often and involve individual and isolated screen makes them more prone to being hidden. Finally, you want to assess academic performance, whether it's been stable or declining, school attendance, extracurricular engagement, peer relationships, family relationships, and engagement in recreational activities. In other words, all the things that are of great importance to people in general and adolescents. Your assessment should finally include safety and risk factors, risk features, asking explicitly about any suicidal ideation, self-harm behaviors, and assess for a hopeless affect. This is particularly important for youth that are experiencing financial loss, experiencing the affect of shame, or having the sense of hopelessness or helplessness that they've done irreparable damage to relationship and educational goals. Next slide, please. I'll unpack this uh, little bit dense but informative slide. Uh, on the left-hand column is the clinical domain, example intake question, and your rationale. So for overall digital use and screen time, you would want to ask, on a usual school day, and this is an example that you would adapt, on a usual school day, how much time or how many hours do you spend, and you could say on a screen, on your phone or your device, your computer or gaming console, not counting homework. It seems like almost every uh, older child and adolescent that I see, it's basically rare to see them not having some screen time and parents involving themselves in regulating the screen time. But you would want to get an assessment of how much investment of time they're engaging in with their screens. This helps to give you a picture of their digital environment because this is the locus of gambling or gambling-like activities. And this identifies the potential for a high risk or high use pattern, and this can be associated with impairments of sleep, feeding, and also reduction in their investment in their school time or other relations. The type of online activity you would also want to explore. What do you usually like to do online? Do you enjoy social media, streaming, gaming, or other apps? Uh, YouTube seems very popular, and it's important to ask what channels they're watching and what it is they enjoy about them. This helps clarify the gives you a clinical portrait of their digital activities and helps include high risk platforms. Are they watching influencers and getting ideas that normalize behaviors where they're spending money on risk-based activities uh, or engaging in sports apps, social casinos, or games with loot boxes or in-app purchases? The platforms and influencers don't have to have large numbers of followers. In fact, there's a more insidious type of influencer referred to as a micro influencer that has a smaller number of followers, deliberately keeps the number, so it seems like more of a peer rather than a role model, also in the promotion or normalization of gambling behaviors. Gambling and gambling-like behaviors. Do you ever play games or use apps where you can win or lose money, points, skins, or other items that feel valuable? So these are again things like loot boxes, I think Roblox, and uh, I think FIFA has that loot box or gotcha pulls, which are in other games. This helps introduce gambling without saying gambling, because they often do not see what they're doing as gambling, but it helps introduce it in a broad, non-labeling, non-judgmental, neutral fashion that helps you get a handle on the real money and simulated gambling. Um, Money and financial impact. Have you ever spent more money on games or bets than you planned or used money meant for something else? And this helps you start to get into the level of harm signal. As I mentioned, the minimum, or as Dr. Cheng mentioned, the minimum number of criteria for diagnosis of gambling disorder is four of the criteria, as opposed to two for substance use disorders. So there's different ways to look at that. The reason there's four instead of two is basically the evolution of the diagnosis from the diagnosis of pathological gambling In the earlier version of the DSM, it had five criteria uh, um, to make sure that there was specificity to the diagnosis. But what it leaves is a little more room to detect a harm signal prior to someone being diagnosed with gambling disorder. For instance, if they have two or three criteria, you're detecting a harm signal and it's time for some intervention and discussion. And this is one of the questions you would want to ask to help detect that. So this question screens for loss of control over spending, financial harm, borrowing or misusing funds, which are core indicators of emergent pathology. Attempts to cut back, similar to substance use disorder. Have you ever tried to cut down on a game, app, or betting activity or found it hard to do? I think people with children find that when they sometimes try to reduce screen time in general, which is a whole different topic, there can be irritability or symptoms or distress. And this assesses impaired control and failed attempts to reduce use, um, as mentioned, paralleling substance use disorder. Next slide, please. Secrecy and conflict. Uh, have you ever hidden how much time or money you spend on games or bets from your parents or friends, or had arguments about it? So, as mentioned, because these operations are occurring on a virtual platform, they're already isolated from view of everyone else. The fact that it's not about a kid going to a casino, but rather accessing these uh, apps privately or games privately already lends to secrecy and the development of deception. So this helps identify those features and also elicits if there have been uh, any conflicts related to gambling or gaming, which are a signal of escalating risk or harm and strain on family relations. Academic and functional impact, have these activities impaired or interfered with you getting your homework done? Or basically, have your grades gone down? And that might be the chief complaint of the family when presenting to the clinic. This helps link these digital and gambling behaviors to functional harms, including grades, school attendance, and other related factors. Emotional function and coping. Do you ever use games or betting to feel better when you are stressed, sad, worried, or bored? So, a lot of people feel that a primary driver for the use of these games or gambling is for affective relief from other disorders, depression, ADHD, impulse control disorders. Uh, but you would use this question to assess the level of use. Now, after a while, without the engagement in these activities, there is an increase in irritability and other symptoms. But this helps explore whether these behaviors serve as coping strategies to manage negative affects. Suicidality and self-harm. Have there been times when you felt so upset about things that have happened, like losing money, having a fight at home about your screen time, problems from online activity, that you wished you weren't alive anymore or thought about hurting yourself? And you would gather a more careful progression of questions depending on the answers to those. Namely, has there been any thoughts of method, plan, intent, or means, or how far has this gone, depending uh, uh, on the level of severity. So this helps screen for acute safety, particularly when there's been financial loss or getting into trouble with the degree of financial loss, shame, or perceived irreparable harm to relationship and their sense of the future. Next slide, please. So next, we're going to look at the validated screening tools. Um, Now, why is it this is so important? Well, if you're busy and you're in your clinic, uh, these things, as we mentioned, sort of have a way of hiding themselves. Same with substance use disorders and some other disorders. Uh, but there's some comfort in the privacy of completing a screen in the waiting room. And this allows you to not only search for the disorder, and often if you don't screen for it, you won't, if you don't look, you will not find it, you won't detect it. But not only can you search for the disorder, but you can collect epidemiologic patterns for your own clinic by seeing how often the screens are positive over the number of individual patients that you see, and you could monitor this. And this may help you to know whether you need to design more specific interventions or do more staff training uh, for the particular disorders you're detecting. So here are the validated screens. The SOGS or South Oaks Gambling Screen, RA, revised for adolescents. Uh, there's a DSM-4 for juveniles, multiple response format. The Canadian Adolescent Gambling Inventory is very thorough, but takes a little more time than the other ones. Now, the two briefest screens are, not surprisingly, the brief adolescent gambling screen uh, and the two-item lie bet questionnaire, uh, originally developed for adults. So what you can do for your initial screening, since it's so simple, is to use the bags or lie bet uh, to see if there's a positive there, and if so, then a more detailed screen in your office, such as the South Oaks or the Canadian. The South Oaks is probably the most popular. So just to give you a little exposure, the bags has four questions, and it focuses on the core harm signals. And its four questions are: in the past 12 months, have you felt the need to bet or wager more and more money to get the same feeling of excitement? Second question is, have you ever lied to family members or others about how much you gamble or spend on games and bets? Third is, have you ever tried to cut back or stop gambling but couldn't? And four is, has gambling or spending money in games. You want to, as I mentioned, avoid the word gambling because they'll say, well, I don't gamble. So you would say spend money in games. Does that cause problems for you, for example, with family, school, or friends? So scoring one or more yeses is a positive screen, and then you would follow up with your clinical interview or the SOGS, South Oaks Gambling Screen, for adolescent, revised for adolescents. So make sure instead of gambling to say, instead of gambling, you say spending money in games. as Dr. Chang mentioned, buying packs or loot boxes or putting money on games or sports. Um, right. Next slide, please. We've gone ahead and uh, provided an additional slide here that gives the specific instrument, the target population, which for us is adolescents, strengths, format, and content limitation, and this will be available to you. Next slide. All right, I'll turn the floor over to Dr. Chang and we'll wrap up with therapy. Dr. Chang will cover psychosocial interventions and I'll briefly cover pharmacology before we take questions. Thank you.
Great. Thank you so much, Dr. Bush. And so I think when we look at the treatment modalities, unfortunately, because there are limits, we have very few randomized controlled trials of gambling interventions in the pediatric populations. Most of the treatment recommendations that we'll be covering primarily draw heavily from adult and mixed age samples. And so, in general, the psychosocial interventions are the cornerstone of treatment for adolescent gambling disorder. And so, when we look across all age groups, the strongest evidence is in support of CBT. And so, when we look at systematic reviews and clinical studies, they suggest that CBT can reduce gambling frequency and expenditure, decrease the urges and the cognitive distortions, and improve overall psychosocial functioning. And when we look at CBT, the interventions are primarily targeting the erroneous beliefs about gambling. And so this can include the illusion of control or near miss interpretations, as well as the gambler's fallacy. We also want to be utilizing CBT to help teach kids about different coping skills for managing the cravings and negative affect, promote behavioral strategies such as stimulus control, and helping kids find other alternative activities. For family-based interventions, these are also very central to pediatric care. So this can include PMT, family CBT, and other structured models. And so the goal with this is to involve the caregivers to help address parental modeling of to address the parental modeling of gambling. We also want to have parents enhance monitoring of screen use and financial access, and also strengthen the communication between the child and the parent regarding money, media, and limits. And so when we look at these strategies, they are consistent with effective strategies in adolescent substance use treatment, where we see that greater caregiver involvement is associated with better engagement, adherence, and relapse prevention. For the group-based and peer support programs such as Gamblers Anonymous, it may offer additional social support and normalization of recovery, but unfortunately, the evidence for the adolescent population is limited. And so, for clinicians, considering carefully whether or not Gamblers Anonymous is developmentally appropriate for the teenage patient. And so instead, potentially even looking into hybrid groups, so focusing more on general broad behavioral addictions or school or clinic-based support groups as well, may potentially be more suitable for some kids. For motivational interviewing and other brief interventions, this is usually used when kids are often ambivalent about change or they're presenting in the early stages of the problem development. And so a recent systematic review and meta-analysis of MI also highlighted that the interventions for MI for gambling are often small and non-significant. So had very limited effect on gambling frequency, money spent, and symptom severity. And so these findings suggest that MI alone may not be sufficient as a primary treatment. And so the way I conceptualize MI is more as a facilitator for engagement. And so MI techniques could be utilized to help the adolescent articulate how gambling either aligns or conflicts with their values and using these MI techniques to help create the shared decision-making process in regards to the next step for treatment. And so, in addition to these more formal therapies, clinicians should also be helping parents implement practical steps. So, securing credit cards and digital wallets, limiting access to gambling apps and high risk games, keeping devices out of the bedrooms overnight, and setting clear, consistent rules regarding the in app purchases.
In terms of pharmacologic management, the this is going to be very brief because there are no FDA approved pharmacologic treatments for gambling disorder in adolescents. Now, there's no FDA approved treatments for nicotine use or tobacco use disorder in adolescence either, but we still use them. Or I should say, things like nicotine patches are not FDA approved, but the AAP feels they should be used off-label because the benefit is greater than the risk. In adults, of course, opioid antagonists such as naltrexone and nalmefene have shown efficacy in reducing gambling urges and behaviors. And we already have a question about uh, pharmacologic intervention, so I'll answer it now. Because there's no RCT, randomized controlled clinical trials for adolescents with naltrexone or opioid antagonists. I really can't recommend it, but it's up to the individual practitioner, and I think the severity. What we can say is that selective serotonin reuptake inhibitors, mood stabilizers, and other agents have yielded mixed results, and the problem is, again, there's no pediatric randomized clinical trials. The thing is, you're often treating comorbidity that involves the use of these medications. So you can also explain to your patient and family that the medicine may serve a dual purpose and may be helpful. But the bottom line is medication should be reserved primarily for comorbid psychiatric disorders, and if they happen to be helpful to reduce the problems caused from the gambling disorder, then you're fortunate in that regard. All right, well I think Dr. Chang is going to go over resources before we wrap up.
Great. Thanks, Dr. Bush. So, we also wanted to include some resources for clinicians and parents. So, one really great resource is Common Sense Media. And so, Common Sense Media provides additional sources as to how parents can implement parental controls on popular games as well as websites. And they also provide recommended age ranges for popular video games, social media apps, and websites. And then Young Gamers and Gamblers Education Trust, also known as YGAM, is also really helpful. So they're a nonprofit UK organization, and they publish these yearly surveys evaluating the gambling rates in college-age students. And they also provide webinars and educational initiatives to help clinicians identify and treat internet and gambling use disorders. And then in addition, the Responsible Gambling Council, National Council on Problem Gambling, and SAMHSA all have great resources as well. I also wanted to share this resource too. So, a very common scenario is that parents are coming into clinic and they ask us, how do they set up rules around social media and electronics? And as clinicians, we're in a position where we can help try to mediate these discussions between the child and the parent. And the American Academy of Pediatrics also created this family media plan. And so this family media plan goes through step-by-step instructions as to how parents and kids can come together to create a plan based off of shared values and goals. They also have in the right-hand side, you can see the YouTube link. They also provide a tutorial as to how to effectively utilize the media plan as well. And that's the end of the webinar.
All right. Well, we'll go ahead and go over some of the questions now, and I think we'll start. I tried to answer one of them. We'll start with one. How does adolescent gambling disorder cross over with internet gaming disorder? So the similarity is gaming disorder if there's involvement with risk-based mechanics. In other words, some betting or involvement where there's an uncertain uh, um, outcome. There's where there can be an association. For example, the use of loot boxes. There's a lot of studies on risk of involvement with loot boxes and gotcha pulls. And there is an association, but there's not, those are all cross-sectional studies. There's not a longitudinal study yet to help demonstrate a definitive connection between loot boxes and gambling. But gaming disorder, internet gaming disorder, is not an official DSM-5 TR diagnosis yet. It's under investigation, although in other countries it is an official diagnosis. But the distinction is very clear in that gambling disorder specifically relies on the criteria for gambling disorder, which you do not have those criteria for internet gaming disorder. And Dr. Chang, if you want to add anything, that would be great. Uh, GLP-1, there's a couple questions on GLP-1 studies, and my answer is, as far as I know, not yet. But as we say in the world of gambling disorders, you can bet there will be some studies on this. There's a very good question at the beginning. Are the percentages higher in real communities? Um, there's the answer is no. The highest percentages are not what you typically see. The reason has to do with sampling. Problem gambling is sub threshold. But I think I want to use this question to emphasize some important issues that affect everyone and everyone's patients. And that is exposure is increasing exponentially. Um, if you'd asked these questions 10 years ago, we wouldn't even have had any of this answer or talk. I think sometimes in other countries, kids could sneak into casinos. But these things like embedding, things like loot boxes and chance-based game mechanics. So that's in distinction to a skill-based game, like Minecraft is a skill-based game, whereas Roblox has more chance-based activities. So that increases exposure. Digital access is increasing because of platforms and influencers normalization. And finally, levels of sub-threshold harm, so less than four criteria are increasing. But again, if you don't look, you won't see the disorder. But if you look, you will see youth with both exposure and early harm signals. We're getting more questions, so let's see if we can get a couple more before. Dr. Chang, do you see any that you'd like to answer?
So I just also wanted to thank Dr. Sinha. There's another really great resource. The 5 Cs from AAP Center of Excellence, Social Media and Digital Health is also a really great resource as well. So I also wanted to highlight that.
Oh no, that one we answered. Okay, there are youth who are engrossed in addiction type behavior, being consumed, basically showing symptoms. Is there some evidence for natural recovery, and is there misuse of overdiagnosing early and overtreatment? Here's the thing. If you're detecting harm, your treatment, and the question is, will there be a spontaneous remission? And I'm not sure there's enough study of the natural history of the disorder to know that. The problem is once there's exposure to these things, the risk of developing a sustained gambling disorder that extends into adulthood or adult gambling disorder increases. And your initial intervention is motivational interviewing, simply acknowledging or empathizing that there's things that the patient enjoys about this, reflecting on that and trying then to ask them, point out, how is this interfering? So rather than waiting for a spontaneous remission, for the CBT, you would want to screen for cognitive distortions like I've lost a lot, I'm due for a win, or I can predict the outcome, or I almost won. That means I'm close. Um, so these it's not these treatments are done in your office. It's not like you're sending someone off for some sort of invasive and disruptive treatment. The motivational interviewing and CBT, and you all are capable of administering these treatments. All right, I think we're about out of time, and I
I
don't
think
want
there's
to
one more
go over.
question, if that's okay. I would like to answer.
Sure.
So,
Yes.
are we
Yes.
regulating in any way how prevalent it has become that celebrities endorse these new gambling avenues? TV, social media, etc., are very saturated by it. And I wholeheartedly agree. I was thinking about when I was reading this question about the Super Bowl, and now with March Madness, we are bombarded by all these celebrities advertising, for example, DraftKings or other betting modalities. And so, unfortunately, from my understanding, we don't really have great regulation, and I think it's going to continue to be a significant problem. I'm wondering, Dr. Bush, have you noticed any major regulatory practices for the celebrity endorsements?
No, there's none at this time. There was a bill in Congress a couple years ago from Senator Blumenthal and another senator, but I think it kind of just has been swept away by the power of the gambling industry, who had undermined the uh, Professional Amateur Sports Protection Act in the first place in 2018, starting this whole mess. All right. Well, we thank you very much for your participation. It's been a privilege for us to present on this interesting and important topic. Thank you.